Thank you so much, Dr. Boutros, and thank you all for joining us here today. We're really excited to have a fruitful discussion about the intersection of health and blockchain. You all know Dr. Boutros, but I'd ask the rest of our esteemed panelists to introduce themselves to all of you.
Great. Hi, everyone. Good morning. My name is Krista McFarland. I'm the founder and CEO of Patientory, and we're a blockchain-powered software company that is, our goal is to really empower patients to get their data in their hands.
Hi, my name is Stephanie Perez. I currently work at R3 in the partnerships team. My colleague Ryan was actually on stage a couple minutes ago and gave some background as to R3, but we currently have a very vibrant ecosystem of partners, 184 as of this morning, that are building the top-of-stack applications on Corda, our blockchain platform.
All right, and Shane.
Thank you. Shane McNamee, practicing physician, Cleveland native, really happy to be here today. Chief Medical Officer of a company called MD Logics, where we identify behavioral health conditions and help people across the continuum. My particular interest here is I led the VA and DoD interoperability efforts for about 10 years with the Joint Legacy Viewer and saw all of the tremendous problems that we have as people across our continuum of care in terms of how we get our health care. So very interested in blockchain in that regard.
So Shane, let's start the conversation with you. So can you help us understand what about the status quo in the healthcare space needs to be disrupted by blockchain?
Sure.
And what is that status quo?
Sure. So we built it wrong, healthcare. At its core data element, it's wrong. We, as patients, and if anybody's ever been a patient in healthcare before, we consume our healthcare across many different facilities, geographic areas, but when it boils down into the electronic health record, which is the thing that manages your care, you don't exist. You're a medical record number, you're a billing number. These things end up being really fancy cash registers, essentially. And I've noticed this over the years as we were caring for the severely combat wounded. I had the pleasure of running a polytrauma rehabilitation center during the Iraq and Afghani wars, and it was incumbent upon us as the clinicians to be able to set out a path and a course for people after they left us, to go back to Idaho or Des Moines or wherever and live on their lives. And ran into over and over and over again the electronic health records and hospitals as barriers and as internally focused. What we lose is the spaces in between. And that may be fine if you're treating an infection or something that can go away, but when we're managing chronic health conditions, this is a problem. And at the core of this, this really isn't a technology problem. We look at it, and you can do patient matching algorithms and electronic data exchanges and whatnot. What we have is a trust problem. We, who should be the core data element of healthcare, I'm an informatics geek, and at that core of what is being built out in front of us and ahead of us should be our own pathway. We should be consuming and driving it from a demand side rather than going into a facility and getting checked in and doing what's best at times for them. But at the core of that, again, it's not a technology problem, it's a trust problem. How do we link together our person as we consume our healthcare across the continuum, and to make sure that our goals and our preferences and our pathways, and that we don't fall through the cracks? At the core of that trust equation is clearly an opportunity for blockchain. Specifically looking at a system to sit atop of, or an information layer to sit atop of, that is your own universal health ID, God forbid, and has the capability to shift, and this is the exciting piece, to shift healthcare away from a supply side to a demand side economic.
Thank you, Shane. Well, so as we think about addressing that question of trust, Krista, can you help us understand how Patientory is helping to tackle that potential pitfall or concern with the present environment?
Yeah, absolutely. And just a little background about, around me. I started off with a telemedicine startup. Telemedicine was a big thing in healthcare about 5 years ago that was really going to disrupt our industry. But we definitely saw difficulty in, just getting a hold of the patient information to actually make it useful for them. And we were an employer mandated system, so as well as for the employers. And then we go into CPT coding. So, research in blockchain, and made sense because we're able to create this network infrastructure that's built on trust, like Shane mentioned, where we can have this interchange of data. So as you know, we tackle interoperability from the network standpoint in being able to interact and integrate with the large EMRs that are out there today, so that we have a normalized system where patients, but also their caretakers, when we look at the push for value-based care, coordinated care, can efficiently and effectively take care of their patient population. So from Patientory, we're really focused on, building a network within healthcare organizations built around trust, but then again, going back to where we see the push in healthcare, creating that empowered patient. Empowered based on they have access to their information. They can securely and easily share that data with whoever they see fit to be able to do that. And I really think that's where we can start to see a lot of the improvements in our healthcare delivery.
Fantastic. So Stephanie, as we think about the technical facets of trust and how they pertain to the healthcare industry, let's think about individuals in healthcare tech decision-making roles are starting to choose which blockchain platforms to test and build solutions on. But many do not apply rigorous criteria when they're weighing the options of what kind of blockchain solution to create. So can you please help us understand the benefits and drawbacks of public blockchain versus private blockchain technology in the medical context?
Yeah, certainly. So I think foremost, you really have to sit down and evaluate whether blockchain is actually a solution for your business problem. It's often perceived as a solution to every single problem, but that's certainly not the case, right? Centralized systems do work in certain situations and certain use cases. But if you have any particular use case where you have distrusting entities that no longer want to rely on one particular party to be able to administer any of that process, and they have dynamic data they're exchanging that evolves over time, then perhaps a blockchain is a suitable solution, right? But there are lots of different flavors of blockchain, and they're often coupled within the kind of public and permissioned worlds, right? So a public blockchain is very much like what it sounds like, right? So entities are able to download the code base, enter the network, run a node, be able to disseminate information throughout the network. Consensus is truly decentralized in that all the parties have to come to consensus about the validity of any particular transaction. Oftentimes it's done through an economic incentive like a cryptocurrency. We see that in proof of work. But for a private blockchain, you're having an entity or a grouping of entities be able to permission someone into the network, which means that oftentimes transactions are only shared with parties that need to be privy to that particular transaction. Consensus is often a bit more lightweight as well because there is an element of trust already in place. So you can support things like BFT as an example, but it really depends on the type of use case that you're building for, right? So if you have a use case where you really care about a low barrier of entry, having as many participants as you can in the network, being able to disseminate that information across the network, and things like scalability and throughput are not as important to you, then perhaps a public blockchain is the way to go, right? But if you're transacting with really sensitive and proprietary information and you need to know who the other entities are, they need to have legal world identities, then a private blockchain is probably the better choice. However, I do look forward to a day in which there will be interoperability between the different types of blockchain platforms because there are functional perspective or functional parts of different types of use cases that are a better fit for one over the other, right? So it's an innovation that I think is certainly coming down the line.
Fantastic. So Krissa, to return to Patientory, projects like yours are putting users in the driver's seat when it comes to their health data. People like you and me need to be prepared to be active curators of our own digital expression, allowing us to engage with that data and to get value from it. From a user experience and adoption perspective, what do you think the biggest challenges are to end users like you and me adopting this technology and becoming savvy custodians of our own data? So, how does Patientory help to prepare its users for this new responsibility?
No, absolutely. And I think just looking at current events, we see regulations like GDPR that are, coming out, are really tries to protect that consumer. And it definitely gives a complementary attribute to why we need blockchain, especially with our platform, public and private keys, really ensuring that, access to that information is really controlled by the individual. In the healthcare space, I think we can definitely start to take, just tips and experiences from the Silicon Valley startup scene. So as we know, PHRs or electronic medical record provided PHRs has a really low uptake, so it's less than 30% right now from patients that are actively engaged in getting their personal health record from an EMR-based portal. So just a show of hands, who actually uses their hospital PHR? Exactly. So for us, it's really actively being in the community, speaking with our end users to build a solution that would keep them engaged. So not only is it a static data storage for your health data, but what are the ways we could integrate with Apple Health Watch, the Fitbits of the world, to really curate and build a holistic, health solution for the patients. And I think that's really the next step in the consumerism of the patient, to really start to see those results.
I would note that the only reason I've ever engaged with my PHR and my clinical providers is out of a morbid curiosity to see just how bad it is. Stephanie, you were going to go on?
Yes, so just to echo that point, with great power comes great responsibility as well. And I think it's one of those things that you very much have to take into consideration during the design process of any particular solution, right? Individuals will need to be able to control their keys and their wallets. And in other different industries, we have intermediaries that have spun up, right? Coinbase is a perfect example of that, hosting wallets and key infrastructure for their end retail consumers. So perhaps it will be the case that will happen in healthcare. Who's to know? But I do think that it's something that you have to take into consideration very early on in the process.
So I don't have a PHR. I have 4 PHRs, and none of them are mine. I participate in someone else's. I have a view into the thing, but as you get more, as your diseases, as burden gets more complex and you get care in more places, we carry these things around, right? And we can participate in them to some degree. Great place, potentially, for a blockchain solution, to be able to pull information together into a trusted place and allow it to be your own safe harbor rather than occasionally parking in somebody else's.
So I would say there's, once we do this, and it is the record is owned by the patient, it involves the entire history, right? There's going to be tremendous amount of data in that space, and one of the things we need and I worry about, we have electronic medical records of patients that are 20 years old. There's massive amount of data in it. In order for me or another physician to go through that and actually know the story of the patient would take enormous amount of time. So we're going to need to have something that goes on top of that permits the patient to write their own story, right? So they actually can tell you their story the way they would like you to hear it. So there's going to have to be an introduction to the PHR, in which I tell you that I'm the father of 3 daughters, that I've been married for 38 years, because it's 32 years, sorry, honey. Together for 38. So, see, I need my PHR, so they're gonna help me with that. So that I can tell you what's really important in my story and what's important in my chronic disease. So while blockchain is going to provide ownership of the medical record and switch it from the health systems, and if you don't believe that we own your medical record, try to get it and see how difficult we make it for you to get a copy of your medical record. Okay? To now you own it, and you're giving us access to actually put information in it and to look at it. I think that's critically important. It will humanize the interaction, but I think it's going to need a story, an introduction to the person on top of it.
So now that we've discussed a bit about the transition from a user perspective to a more agency-driven, autonomous, and independent role of data, Shane, can you help us understand perhaps what some of the challenges to onboarding and scaling from an enterprise perspective might be? What might limit or challenge the ability of these new technologies to scale in the medical space?
There's always the big one, which is who pays for it. Right? So if we talk about this great space in between, when we look at things from a healthcare perspective, we see what we do is incredibly important. And the hospital encounters and how we treat people are incredibly important. But realistically, it's less than 1% of our lives. In this grand space in between where we live and should be promoting our own health and avoiding disease, we have very little capability to get into that. So number one, who pays for it? To me, just from a business model, that's a massive issue. Dr. Boutros was talking about, on the second hand, is the amount of data, right? Huge amounts of data, very little information. And if we are, as people will want to do, transact these data files across through a block application or something similar, we don't have enough computing power to do it for everyone, and it's a true waste there. Ways around that are standards-based, FHIR-based block identity management solutions, where you can just allow that to be the key and allow information to flow from a smart contract perspective. But then on the back end of it too, when we talk about healthcare providers consuming our data and then moving along the lines of what we should be doing over time. I had the opportunity to build and run the VA DoD interoperability solution, and at point of care, I was trying to explain to the technologists that we can't wait 2 minutes for the data to come back. You can't sit there and hope that that's going to actually affect the healthcare moment. So the capability, number one, to be able to make sure that the pipes are flowing through, but again, back to what Dr. Boutros said, is how do we separate the signal from the incredible amount of noise that's in a health record? To me, each one of those are stumbling blocks and opportunities.
So as we start to think about the adoption of blockchain technology in the healthcare space, Stephanie, is there a particular facet of the industry that you think is especially promising or interesting?
Yeah, so we were actually talking about this previously, but medical records is like the super interesting, sexy one, right? But revenue cycle management is a process that involves so many different sub-processes and so many different players, and it's extremely cumbersome right now. So for example, we actually have a company based out of Atlanta that has built a solution for bundled payments. Mm-hmm. The idea of being able to foster value-based care, value-based contracting and models are they're difficult, they're complex. You basically have to have lots of different parties be able to agree upon what a positive patient outcome is, and then be able to share information to attest to the fact that that's actually the outcome that you said it is. And then if you're doing retrospective payments, then you have to do reconciliation as well. So a lot of that could actually be very much parameterized through smart contracts. So this particular startup is looking to really operationalize episodes of care through smart contracts for things like knee replacement, hip replacement, birthing, so that you can very much have a contract that will include information as to what's what's considered to be in the episode of care or excluded from it, and then what the corresponding payment levels would be. So it's tying, I think, improved data quality, more transparency in pricing models, and overall just a better patient experience.
Can I back
Please,
into that
yes,
a little bit more?
absolutely, always.
So I think she nailed it in terms of the need for really effective revenue cycle management that is focused upon us. So I had the unfortunate opportunity to have a knee surgery and a breast lump removed in the same week and 2 different encounters from the same hospital. Everything was fine. And then I sat and watched the medical bills come in. And everything looked the same and everything looked different. And I told my wife, I said, don't pay a single one of these, because I'm going to figure it all out. I'm going to take all of this data and figure out what we should be paying and we shouldn't be paying. And I spent 6 months on the phone and spreadsheets and working through. And Amy, my beautiful wife, at the end of it said, should I pay these? And I said, yes, of course you should pay these. Right? So we don't even understand how we consume and pay for these. So from an RCM perspective, I couldn't agree more.
So if you think about the contracts in healthcare, you or your company have made an arrangement with an insurance plan. You have a contract, and it says, if you have these things, this is what they will pay. The first thing in healthcare we gotta make sure is that you're you.
Right.
So this is the authentication of who you are. Then, and by the way, we don't do a great job with it because there's folks who are using other people's medical cards. And that, from an electronic medical record perspective, is a disaster, right? So if I have your siblings' information in your medical record, it stays there for a really long time, and you're gonna have to prove to me you weren't that person, right? So the first thing, I gotta make sure you're the person. Then I gotta make sure you're the person who has that coverage. Now that coverage is still active. And then I gotta authorize whatever I'm going to provide you, which is all in the contract, because we have a contract also with the insurance companies. And then after we deliver the services, we're gonna have to say that we actually did deliver the services. We have to prove that we've delivered the services. And then if they believe us, then they will bundle it together and send us money at a certain date, right? All of that can be done seamlessly and through a blockchain application. And today, I just want you to understand the magnitude of amount of dollars that are spent in healthcare. 5% of your healthcare dollars are given to your primary care physician. 5%. Almost equal amount is spent in this nonsense. We could double the amount of care you get from primary care physicians if we just eliminated this craziness. Okay? That's just nuts. That you're getting no value. Somebody wasted 6 months of their time, and had he called me, I would have said, call Donna Graham, who's our revenue
hospital.
It's okay. She's the revenue cycle person. Yeah. She will tell you what you need to pay. And if you ask her to explain it to you, it's going to take you 6 months.
Right.
So you might as well just trust her.
Right.
She knows what she's doing. Right? Today, you don't need to know a Donna Graham to figure this out. You need to be able to say, based on my contract, that is what I was supposed to pay. This is what the hospital was supposed to get paid. And because of all of this nonsense, healthcare systems have charge masters, okay? In which we say our price sticker is, by the way, for an aspirin, like $180. We get paid 2 cents for it, but our sticker price for it is $180. So there is no transparency. None of the information around pricing of healthcare system is real. No one ever pays the sticker price. Not Medicare, not Medicaid, hopefully not the self-insured people, and if you are, you're being duped, and not insurance, enough folks are insured. So this will actually help us, and I think before we get into clinical systems and all of those, there are so many business systems that we need to get into with blockchain that are going to offer tremendous value because it's going to lower the cost of all of those things.
And the way you go about developing these applications as well is that you can't solve the whole problem from day one. It's okay to build for different point solutions and eventually have interoperability between all of those different applications. But certainly to have really lofty goals from day one is just not realistic.
Absolutely.
So as we start to think about bringing it down to where we are right now, Dr. Boutros, can you help us understand why Cleveland is uniquely well positioned to explore the blockchain space in healthcare, and what sets the city apart when it comes to thinking about applications that can be really impactful, not only for patients, but for the whole community?
So I think there's a few reasons. I would say one is that this city recognizes that it missed the internet revolution and really understands that when we become deindustrialized as a city, that has taken a tremendous toll on this city. So all the leaders, both government and business leaders and civic leaders, understand we have to do something. And we've actually, because of folks like Highland Software who are here, figured out that we can actually have a robust technology platform here. And then you have the Cleveland Clinic and University Hospitals, and to a certain extent, Metro Health, who are doing some incredible research that actually is translating into some applications, both on the biomedical side and also on the information technology side. And one of the nicest things, and I don't often talk about this, is that there are only 3 major health systems in Cleveland. You only have to have these 3 relationships in order to get things done. In New York City, it's 13 health systems who hate each other. We're in the Midwest, so we don't hate. We're very polite. So we can. It's small enough that we can work together, but it's large enough that we can actually make an impact. Cost of living is a tremendous difference. For if you have a startup company and you're in New York City, you're going to burn through your capital, much quicker than you would in Cleveland. And lastly, I would say to you is that we're figuring out ways of keeping some. You just heard the announcement from John Husted yesterday, who said he's making sure that IP is owned by the person who develops it, not by the hospitals, not by the universities. So I think what is being created here, and we've got folks from Israel who've decided to come here because they're seeing the potential in Cleveland for not only to develop, but actually to take their applications and have health systems like Metro Health, and I'm just announced it. We are open to work with new developers to figure out how to utilize their information. You need somebody, you need a customer, you need an initial customer to do that, and we will do that with you. That is what we think how we're going to differentiate ourselves. I met a physician who's working on physician credentialing. Mm-hmm. Physician credentialing, an absolutely terrible, time-consuming, non-value add process that can be done with blockchain, right? He says he's got it. He thinks he's got it in 4 months. He'll be able to roll it out, and I told him to come by, and we'll be happy to work with him regarding that. So you have willing participants. I think the dollars are going to be flowing here, and the cost of a startup is going to be significantly lower here.
So Chris, thinking about being a technical entrepreneur in the blockchain space, can you talk a little bit about what, as in this role, the community, what interactions you've had with the community that have been really positive, and what you would like to see from the community to help you succeed as an entrepreneur in this space?
No, absolutely, and Patientory this month is in our 3rd year, so we were pretty much on the bleeding edge. When I went to pitch to venture capitalists, they thought I was from Mars back in 2014, 2015. But we're based in Atlanta, Georgia, who's much like Cleveland is definitely a mid-sized city who's really interested in seeing positive and really beneficial healthcare IT and just healthcare companies be able to survive and evolve and make a big impact. So from the beginning, I was really met with accelerators and incubators that were willing to be a part of our journey. And I think as an early stage company and for tech entrepreneurs, it's really important to, like Dr. Butcher said, be a part of a community in a city that's really geared towards the success of your company. And just helping with whether it's product development, introduction to beta customers, which is really important, especially for blockchain in an emergent space to really start to show that value, for a company is really important, as well as support. So we have an annual conference. Our city, helped in, sponsoring that and really helping with that engagement. So for tech entrepreneurs, really, find a ecosystem, a community that can help with that business development.
Hear that, Cleveland? That is what blockchain healthcare entrepreneurs need to succeed. So I know we've got a few minutes left here. We were planning in this conversation to open it up to questions from the audience so we could have an opportunity to engage with you all. I'm not sure if we have microphones walking around here, but we promise we'll listen really closely. So if you have a question, would you mind coming to the front of one of the aisles? And our panelists would happily discuss with you. Don't be shy. All right, well, while you think of those, feel free to come to the front of one of the aisles if you would like to ask a question, but otherwise, we can continue our conversation up here.
Yeah, so one of the things I neglected to mention is there's a significant effort. You said you need an accelerator and an incubator for your business. There's a significant effort going on right now for us to create that in Cleveland. I think it's going to be an announcement that's going to come after the conference that we're talking about putting together the space for people and the support structure. So you don't have to create your own business unit. You can actually rent a desk. You will have all the support services for you to be more successful. In biotechnology, for example, Case Western Reserve is helping us with the core labs, right? So if you have a biotechnology company, instead of spending hundreds of thousands of dollars and millions of dollars of getting a lab that can perform all the testing that you need, for a very modest amount, 10 to 20% of that, you can go to Case Western and they will do the core lab function for you. So you can keep your dollars in keeping your company going.
Wonderful. It looks like we have a question to kick us off.
Hi, my name is Doris Bowman, and I'm interested in hearing from everyone about home health care application for blockchain. Not just folks maybe who have been recently released from a hospital, but at long-term, chronic. Home health care is the key question. So just any basic information. I'd personally be interested in it, so thank you.
Thank you. Yes, so the question is, as we think about home health care, how does that intersect with the evolution of blockchain and technology?
So if you ask both patients and doctors why you don't provide more care at home, it's worry. It's concern about the safety of the patient and the ability to intervene. I think technology in general is going to permit us to be able to reduce the number of admissions to the hospital and be able to take care of patients on the outside a lot more. My wife hates hospitals, right? And she would have, had suffered from a cellulitis infection years ago. And she said to me, "I'm not going to the hospital." I said, "Well, you really need to be hospitalized." She said, "You're a doctor, figure it out," right? So she was never hospitalized. We treated her at home because there was a reliance that we could provide these care and services. Well, for about $2,000 a day, which is how much it costs for you to be in a hospital, I can have a doctor sitting by your bedside for the entire amount. It wouldn't cost that much money. So I think having those safety and technologies and being able to make sure that your medication is coming to you at the right time, that the nurse, that the doctor, that the therapist, that everything else in the chain is happening, or somebody's getting notified, so there's an intervention, right? I think is going to permit us to be able to provide a lot more care. I see hospitals are going to come to a day in which the only thing you're going to be doing is complex surgeries, like such as trauma or burns or things like that, okay, transplants, okay, and childbirth. That's it. The rest of it is going to actually go out to places outside the hospital system. So we at Metro Health are no longer thinking of ourselves as a hospital system. We are actually a health maintenance and wellness company.
Any other thoughts on the role of blockchain?
Well done. So this is the great spaces in between. This is where we live. You end up running into the same issues, though, when you try to authenticate in the hospital. Is it the right person? right? Are the right things being done there? How do we best mitigate the risk associated with those situations? And to me, it's the intersection, specifically to your question, between value-based care, which we all seem to kind of get, but really have trouble putting our arms around it from a business economic, and blockchain that allows for, again, shifting away from a supply-side economic to a demand side, so then you can get people into the home and can be paid for, and the entire system or the healthcare ecosystem that's around can all participate in that regard.
I think we've got sorry, do you want to respond?
I think that home care will also probably highly leverage IoT as well. And IoT can be very much fed into multiple different types of distributed ledger technologies through things like oracles to kind of trigger events and processes.
Yeah, as well as just to really echo what the panelists have said, and start looking into how AI can help facilitate those visits. So once we have that security in place where we feel we can provide care outside of the hospital, in the home, then we'll start to see more of that technology maturation over time.
So I want to ask the audience a question. How many of you get an unscheduled call from your doctor asking you how you're doing? Oh, somebody does. Are they related to you? So if you think about medicine as designed as rescue medicine, that's what we've been just dealing with, right? Yep. There's a crisis, we swoop in our Superman costume, we help you out, you say, oh my God, look how great these people are, you pay us a lot of money, and we're all happy, right? And we could have prevented whatever the issue is at a lot lower cost. So I think one of the great opportunities for having all this holistic data in front of us is actually predicting bad things before they happen.
Bingo.
So today in real life, if you're a class 3 heart failure patient at home, we can use avatars and look at how you're walking around your house, where you're sleeping, or not. And we can predict your hospital admission at least 3 days before it happens. So if a red flag goes up, we know the patient is retaining fluid. All we have to do is send somebody there or have a conversation with the patient, slightly change their medication, and be able to avoid an admission. So that's where the opportunities are. I think you have a question over here.
Do we have time for one more
Oh, wait,
question?
hang on. I think we've got the mic over here, but we'll get you next.
Do we have time for one more question?
Yes.
Well, my question is about the interoperability she was talking about. The one of you's on Corda, the other one's on Ethereum. I'm a person now who's putting my mother-in-law's betas on disk because beta lost a VHS. And so if you create these systems and you say, I want one little part, and then we should all interop later and make this big chain, that's the best way of doing it because you can't do all at once. How do I feel comfortable on what I'm working on and which platform and what particular part?
Sure, yeah.
I think this is the importance of standards, right? So we built this country first with a series of railroads that didn't interconnect with one another and interoperate with one another. It wasn't until that we developed and agreed upon standardized railroad sizes and gauges that the Industrial Revolution happened, right? We're still in a stage right now from a technology perspective where from these tools, they don't interoperate with one another because it's a business advantage. So this is where standards cut through and into and begin to allow things to transition across. So it's a very weak or non-specific answer, but engagement of standards in these things early on to allow blocks to interoperate with one another, I think, are critical.
Evan, so you built on Ethereum. Why Ethereum, and how will people be able to utilize it?
So we believe that the Ethereum platform is the most promising of the public chain technologies. Not only does it have the largest developer community, but also some of the most sophisticated implementations of secure data management. We build on the Ethereum platform because we think that the public chain and transparency is the way of the future. However, we are very focused on cross-chain interoperability. So when we develop our open source low-level protocols for developers, there's nothing about those protocols that's unique or specific to the Ethereum platform. They can be implemented in a private chain instance. We actually have a lot of private chain instances of that protocol implemented to prove that it works, because we think that from a developer perspective, the most important thing to build out this blockchain landscape is to allow individuals to build the experiences that they want to deliver with the tools they feel are best suited. And so from our protocol team, there's no identity solution that we are tied to, and there's no storage solution that we require developers to use either. And so what we're really focused on is crafting a set of tools for those who will build our future systems that allow them the agency to create a very specific experience for their users, and one that doesn't trap their data in a single silo. And to Shane's point about the commoditization of data, or how do we create an equal playing field where data hoarding, which is the way that we operate today, is not financially incentivized. And the way that you address that in the medical space is that you facilitate cross-chain interoperability. There are a number of technical teams that are researching and developing solutions for this that will allow not only for public to private cross-chain interoperability, but also among different private chains. So now we wait.
From a platform perspective, I come from a little bit of a different world in that Corda was built based on some of the requirements of our initial members for a permissioned blockchain. So yes, I mean, actually, if John was here from Accenture, he would love to talk about this interoperability, because it's something that Accenture has actually worked quite a lot on across numerous of the different public and private blockchains. But when it comes to interoperability, actually, we also think that there's interoperability within our own network between different business networks. And the reason why I say that is because there may be some participants on Corda that are in a trade finance network for one particular use case, and also in a capital markets, and I'm giving a financial services use case, capital markets application. At the end of the day, by having a similar identity structure and a doorman service and a network map, you're able to know who the other entities are in the network, so that it's more easy and seamless for you to be able to move assets across those different networks. So eventually we'll have cross-pollination, but even within networks, interoperability is super important.
Yeah, and from a platform, a DApp standpoint, distributed application standpoint, at Patientor, before we even started building our architecture, we definitely had in mind this system of interoperability, to the point where our DApp is blockchain agnostic. So right now we're integrating with P2Net, which is a fork of Ethereum, private Ethereum network. But we also played with that idea of building oracles into, Hyperledger, Fabric, Corda. So I think as, companies start to build more decentralized applications, they definitely have to look at, interoperability as a future product roadmap down the line.
And if we think about today, what is our data landscape, right? Everybody, or every company, whether it's Epic or Instagram and everyone in between, they have servers that hold their data basically in a silo that is designed to not be shared, to not allow users access to that data. And so what we have are these sort of completely separated Fort Knoxes that store various kinds of data. If we develop a landscape of different blockchains that cannot talk to one another, we will have built the same landscape, except for it will work worse than it does now. Yeah. So it's sort of interoperate or die, I think, for the future of Web3.
So in society, we're still at a stage where data hoarding, as you said, is one differentiator between one company and another. I think we're going to get to a point, is not the data availability is going to be ubiquitous. It's what you do with that data. That is the real value, right? So it shouldn't be available to only a few people to be able to find out what's the best solution. NASA did a case study in which they had these astrophysicists in which they were looking for these solar flares to predict solar flares. And after 13 years of working on it with astrophysicists, they can predict solar flares accurately 51% of the time. Millions of dollars spent to gain a 1% improvement than a flip of a coin. They put out this a solution and said, whoever figures it out is going to get, the solution will be named after them, and they'll get a small prize, right? The astrophysicist said, nobody's going to figure this out. You know, we're the experts on this. We're gonna know what to do about it. There's a mathematician with a cat on his shoulder who figured it out in 6 weeks. Okay, he sent his picture in with the thing, and you see this guy in one of those large easy chairs, a cat on his shoulder and a laptop, figuring out this thing, right? So it's not that they made the data available to everybody, and he was able to make the best solution out of it. That's where value needs to be rewarded, not in hoarding data.
So we've got about 3 minutes, so if you can sneak in a quick question, I think we have time for one more.
Yes, very quickly, and I think it'll be more of a statement. My name's Phil Larman. I'm founder of Notary Pow. I just recently relocated from California here to bring jobs, and I wasn't going to ask you a question, but it actually answers one of the problems that you brought up, being able to verify the actual person. So what we do at Notary Pow, we're building the first enterprise-grade video notarization platform in the world to act as that third party to bridge that gap, that human element. You guys are catering to a lot of the elders. We're talking about home care, but we have all this wonderful technology, the blockchain, right? But how can we bridge that gap to be able to be inclusive of folks that actually are very deathly afraid of technology? There's legislation that's being voted on right now, actually, down in Columbus to make this legal. So we would be only the fourth state in the entire country that this would be legal right here in the state of Ohio. So to be quick on your 3 minutes is more of a statement, but I would love to hear your guys' thoughts on how do we continue to bridge that gap. We have this wonderful technology, but how do we continue to pull people through who are deathly afraid of the technology at the end user level?
I'll jump in with a real quick response there. I would say that the majority of patients are not particularly familiar with the technical process or the software that their physician interacts with. In fact, I would be willing to bet that if you started using blockchain-based patient data management, a very small percentage of patients would notice or care if it works and it's secure. Any other quick thoughts here as we wrap up?
Yeah, and just to add on from a technology standpoint, and why we're here today is really looking at how can we achieve adoption. You know, patients don't have to know how blockchain works. We see it with the internet as well. No one can really explain how the internet works. And I think true value, true adoption is going to be achieved when, you know, end users can, you know, seamlessly, you know, have the technology integrated into their daily lives. And then it goes back again to our point earlier in the conversation, and, you know, how can we create user-friendly, user experience web portals and just, you know, front-end technology that can really appeal to this consumer population.
All right, thank you so much, Krissa, and panelists, thank you so much for joining us today. Audience, you have been great.
Thank you.